What is gum inflammation? Why do your gums bleed? Is it normal? Should you ignore it? Ideally, we want full health in our mouth and we don't want gums to bleed. With healthy gum, we have the tooth, we have the ligament that supports the tooth in the socket, in the bony socket, and we have the gum, the margin of the gum. So this first black band on the probe is 3.5 to 5.5 millimeters. So ideally, less than 3.5 millimeters with no bleeding when I'm probing. In many cases, we get a bit of gingivitis. Itis is inflammation, gingiva is what we call the gums. It's your body's natural reaction to get rid of bacteria, to become inflamed, to heal an area. The whole inflammatory process is a protective process in your body. So when there is bacteria left behind, we get the body's host response in rushing to that area with defence cells to try and get rid of that bacteria. So it will send the defence cells, the blood cells, up to the gum to try and remove whatever's there. When you get a bit of bleeding from the gum, it can look quite serious, it can look quite red, it mixes with saliva, it mixes with gum fluid. If it was your leg, we'd be saying leave it alone to heal. But in your mouth, we want you to encourage it. If you're seeing bleeding when you're brushing or you're flossing, it's because there's bacteria there, more often than not. And we want you to remove the bacteria. If you remove the bacteria and you clean that area, your body's going to stop trying to clean it for you and you will get reduction in bleeding. Sometimes it needs a bit of a reset. If you've got a lot of tartar in there, you need to come in, let me give you a good clean, full mouth detox, get you back to your, a scratch, and then start again and try and keep on top of that plaque bacteria that's in there. If there's hardened tartar in there, it is plaque retentive, so it's going to hold a lot more bacteria. Tartar itself isn't disease causing, it's the fact that it's rough and harbours a lot of bacteria on it, and it's the bacteria that's disease causing. So get rid of all that bacteria, make everything really nice and healthy for you, get rid of the tartar that's harbouring the bacteria. Gingivitis is surface inflammation. Everything's still, all your attachment, all your bone and everything that's holding everything in place is still completely fine. It is just a surface swelling. So we call it pockets that we're measuring for pockets, and we would consider a false pocket to be any swelling that's above the gum. So it's not a true pocket where we've had loss of attachment, it's a false pocket that's above the gum. Once we've removed any plaque retentive factors and any plaque from the surface and you're cleaning effectively, then it's going to go back to being nice and healthy again. Gingivitis is totally reversible without any lasting damage. There are other reasons why we can get gingivitis. We can get gingivitis due to hormonal changes. You might have heard of pregnancy gingivitis. In perimenopause, menopause, we can experience gingivitis because of fluctuating hormone levels. There can be other reasons why, medical reasons. The main reason for gingivitis is it's a reaction to plaque. And if we're controlling the plaque, we can control the gingivitis. What we're checking for when we're measuring is periodontitis, and it used to be known as pyorrhea of the gum. Periodontitis, again, we have the itis, the inflammation, and the periodontium is your supporting structure. That's your bone and your ligament that supports the tooth in the socket. So it's your underlying structures. Periodontitis, not everybody will be susceptible to periodontitis. It can be genetically linked. If your family have a history of periodontitis, we know that there has to be gingivitis there first before we'll develop periodontitis. So if you're noticing bleeding gums, we want to catch it early. We want to reverse that gingivitis and stop it from progressing into periodontitis. What happens in this case is that the bacteria becomes a bit more harmful. It can survive in environments without oxygen. It creates a little shell over itself, it becomes more harmful, develops a little ecosystem, releases toxins, and those toxins cause inflammation. And that inflammation causes destruction of your supporting structure. And we measure a true pocket, and then we get a depth where actually we're able to slide down the side of the tooth. The thing with periodontitis is it can look like gingivitis, and more often than not is painless. So if you had pain from periodontitis, we would catch it earlier. But because you don't get pain from it, it's not like a toothache where you're suddenly seeking help for it. So it can go undetected if you're not having regular visits to the dentist or the hygienist and you're not having the gums measured. We can also see on radiographs how the bone levels are doing. We do lose a little bit of bone. We get a little bit of horizontal bone loss due to aging, but that's slightly different from what we see with periodontitis. If you don't do anything about periodontitis, eventually it will destroy more and more of that supporting tissue until we've lost quite a lot of support in there. Now that's where we're getting mobility in the tooth. The tooth is no longer held in up to the neck with bone, so we start to get this movement in there. Many years ago, if you had pyrrhea of the gum, you were usually sent to have all your teeth out, because that was the easiest way to cure it, we thought. If we take out all your teeth, you won't have any more pyrrhea of the gum, any more periodontitis. You'll be glad to hear we don't do that anymore. We can treat periodontitis, and quite successfully. The earlier we catch it, the better. Getting implants when you have periodontitis is not a fix for it, because where with natural teeth we have gingivitis and we have periodontitis, with the implants we have mucositis and we have peri-implantitis. Lose implants the same way as you can lose natural teeth if you are susceptible to periodontitis. So taking all your teeth out and putting in implants isn't a great option. The chances are that your implants are going to fail if you have unstable periodontitis. First of all, we have to get you controlling the plaque. So we have to get you cleaning every surface of every tooth every day. And that's quite a big ask, but we have to get you 100% on your plaque control. We need to stop the fresh plaque that's causing the issue and control that. And then we do slightly deeper cleaning. So we have special instruments. I have special instruments, I've got special powders for biofilm disruption that I would use below the gum, and we would clean below the gum. When we clean below the gum and you're stopping anything from going back down in there, so your plaque control at home is excellent, we can get new tissue attachment. So first of all, we get the epithelial cells reattaching, long junctional epithelium, but we also get some ligament reattachment, and the soft tissues will reattach. Bone is very quick to disappear and very slow to come back. There is phases of periodontal treatment. So first of all, we would be wanting to get your home care excellent. We would be wanting to remove all the plaque retentive factors, so that's all your, the hygiene would take care of that, making sure there's nothing in there that's going to retain plaque and make things more difficult for you. Then we would do non-surgical periodontal therapy, and that's where we're doing the deeper cleaning under the gum. And then we have surgical options. There are options that if we have done non-surgical periodontal therapy and we've cleaned out underneath the gum, and there's still some pocket in there, or there's some difficult areas, very often if there's been loss of attachment that is lower than where the root split, so where the root split is called a furcation, right here. And if there's furcation involvement, it can be quite difficult to get in there and clean that area. Sometimes there can be bone loss just around one of the roots. So the top molars have 3 or 3 rooted, your bottom molars are 2 rooted. It can be that just one root is affected by bone loss. So there are surgical options where you might lift a little flap of gum and clean away any granulation tissue, any scar tissue that's around the area, make sure everywhere's nice and clean. They can use synthetic bone, they can use membranes to allow the right cells to attach to the tooth, so that rather than having this skin cell attachment, we're getting a pure ligament attachment that's going on to the tooth. They can use bony infills to build up the areas where they'll take a bit of the root off that's affected by the bone loss to allow the rest of the bone to generate around the other roots that are there. There are lots of options to save your own teeth. And we're wanting to preserve as much bone as possible because it preserves your face shape. The load bearing, spreading the load in the mouth evenly over the teeth is really important as well. We're not wanting to take teeth out that we can maybe save. Gone are the days where we kind of marked everything as kind of hopeless prognosis and just whipped it out. Now we want to give it a go and see if we can get some regeneration in there. So if you do have periodontal disease, if you do have mobile teeth, it's not the end for them. There are treatments out there where we can try and stabilise everything. So yeah, that's what we're ruling against, and that's why it's so important to come regularly to the dentist, because like I say, periodontal disease is painless. You know, periodontal disease is linked to over 90% of systemic disease. So if we're keeping your mouth healthy, we're keeping the whole body healthy. So yeah, and you know, the easiest way to do that, come and see us at O. Let us measure your gums, let us keep a check on everything for you, and let us refer you on. We'll signpost you to the help that you need if you need extra help that we don't provide down here. We have a range of lovely dentists and specialist dentists who we can signpost you to if you need any extra help.